Hello, wonderful viewers. You're watching us on BFP Live, and I am your host, Aisatu Wada. This is your show that comes your way every week, and it is called the Health and Fitness Show. And we will be talking issues concerning our health. And today, our topic of discussion will be centered on diabetics. As we all know, diabetics is a major concern. And here with me today, I have Mr. Usman Toure, who will be joining me in the show. I will let Usman Toure introduce himself to us, then we can go into the discussion. Hello.
Hi, thank you very much, Madam Wada. I am very much delighted that this important topic is brought today, and I have been chosen to discuss this to the viewers. I am Usman Toure by name, registered nurse by profession, with 3 years experience. I started my working career at the Edward Francis Small Teaching Hospital, and I joined this hospital in January to February 2017. And in November 2017, I started the diabetes and hypertension clinic of this hospital, which I ran until 2019 April before handing it over to other people.
Mr. Toure, as we all know, diabetics is a major concern for all. What are the major causes of diabetics?
Well, diabetes in the first place, I would start by telling you a few words about its definition. It is a chronic condition which results from deficiency of the body in utilizing the insulin. So this leads to problems with metabolism of carbohydrates, leading to high glucose level. Glucose is sugar in normal English. So the causes of diabetes is there are many, but there are two types of diabetes. We have diabetes type 1 and diabetes type 2. That is for diabetes mellitus. The diabetes type 1, it has no confirmed cause for now. Researches are being done to establish actually, but what is known so far is that it is an autoimmune disease, meaning the body fights against itself and kills the beta cells that are responsible for producing insulin that drives the glucose from the bloodstreams into the body. So if this system fails, then diabetes will occur, and that mostly affects young people. It used to be called juvenile onset diabetes. Now coming to diabetes type 2, which constitutes about 90 to 95% of all diabetes cases in the world. We look at it from different perspectives. Diabetes type 2 is caused by many factors. One of the factors is lifestyle, like people in activity. People are not active, people are not exercising. And then diet, the kind of fruits that we eat. People are eating junk foods always, fatty foods, and then all the time carbohydrates. And one of the other risks, when we're talking about the causes here, we have to bring the risk factors into consideration. That is somebody whose family has a history of diabetes, perhaps your mother or your father, or your close relatives like your biological brothers or so. If they have diabetes, it means it is part of your family. So you should be more cautious than other people. And mostly type 2 diabetes affects people that are above the age of 30, mostly from up to 70 years old. That range is the time that most people get their diagnosis for type 2 diabetes. So lifestyle is one of the key factors. That is people being not active, and then the kind of fruits that we eat is also another contributing factor to diabetes that is happening in the world today.
Okay, Mr. Toure, as you said, how can one know that he or she is having diabetics, or what are the signs and symptoms that will show you that you are having diabetics?
Yes, diabetes has a lot of signs and symptoms, and I will outline all of them here. If even not all, but key relevant ones that every other person can observe in yourself. Diabetes, it deals with few things. That is, when the sugar levels are high in the body, it leads to what we call osmotic diuresis. And this is what leads to frequent urination. Your body will be trying to dilute the amount of sugar in the bladder by pulling the water around the bladder surrounding, and the bladder keeps getting full quickly, and then you keep on going to urinate. And the more you are urinating, the more you are losing water, the more you are drinking. So the cycle continues. You will always be thirsty, you will always be hungry, and you will always be urinating. If you see these signs in yourself, then you definitely know that there is a cause of concern for you to check your sugar status. So these are the basic signs that you will see. And then it accompanies what dizziness may happen in some cases. In some cases, you will be sweating and trembling if your sugar level is down, generally feeling tired or weak, and then you feel like you are always exhausted, and then you are always sleepy. All these things happen. But I'm telling you, the cardinal signs that you will see is your number of times to wake up at night to go and urinate, which we call nocturia, becomes so much. It becomes too much. In the night, in one night, if you are urinating, going to pass urine for about more than 3 times, more than 2 times, you should start being concerned about your sugar level. If it gets to 3 or 4 times or 5 times, you know that there is definitely something wrong with you. Okay, and then also you're always drinking water, and then you will start losing weight. If you are somebody with weight, when you have diabetes, you will start urinating too much, you will start drinking too much, and you will start losing weight. Your friends will be telling you, hey, but you're losing weight, what is happening? And then you will start getting concerned, why am I losing weight? But if these things are together, weight loss, you have frequent urination, frequent drinking, and frequent eating, you will realize that there is a cause of concern for you to go and check your sugar level. So that you have the signs, but it is also possible you may not be diabetic, but it is very highly likely that you have diabetes if all the symptoms are present. Sometimes they come one at a time. First, it will present mostly in some people, you will be drinking always. Every given point in time, you'll be telling people, can I have some water to drink? Maybe if you're always sending your kids, sisters or so, they'll be like, you are always drinking. All the time you're sending me to get you water. You'll have this. And then it goes to some time. If you are a little bit active, the urination problem will not come early. It will delay. But the moment you stop all that football and all that exercise at the field or so, you will see the urination will start coming. You will frequently urinate. Then this is how it goes. So it is important. And most of the diabetes patients will tell you, my throat is always dry. I am always feeling like I have to drink some water. So these are the kind of things that will happen to you. So if you see this kind of signs, you will definitely know that you definitely need to check your sugar level to know if you are really diabetic or not.
Okay, as you said. And what are the type of food that a diabetic person should take, or what are the type of fruits that somebody who is having a diabetic should take?
Okay, that is under a whole topic called living with diabetes or managing diabetes to make sure your sugar levels are controlled. Okay, but your question specifically talks about the food, so I'm going to focus on that. For diabetes, what we need to know is the body has glucose impairment, glucose metabolism impairment. That is, your body cannot process glucose correctly. It remains in the blood, in the veins, blood vessels, and that when you check your sugar level, it is always high. So what we need to know is carbohydrates. Those are fruits that are going to, their endpoint is glucose in the body, like carbohydrates. Those are starchy fruits like bread, rice, this gari, fufu, Irish potatoes, these spaghettis, and anything that can be made from flour, like bread, and then anything that can also be used to process flour is the same. So they are the foods that are having a high glycemic index, meaning their sugar levels are very high. So those are the fruits you need to limit. Let us first know what we need to limit, then we move to what options do we have. Yes, if you limit these kind of fruits, because in the Gambia, the staple food is rice, people take bread, and all those are not very friendly to diabetes. So what should we eat instead of these rice and breads? What we need to eat more is vegetables. In a day, 50% of the food that you consume should be vegetables. And when we talk about vegetables, we're talking about cucumber, we're talking about carrots, we're talking about lettuce, we're talking about garden eggs, cabbage, and others. All those are very important. So if you can afford it, they should constitute 50% of your daily diet. That is, if you put a plate, you cut it into half of that plate should be vegetables alone, and the other half you cut it into two. That other side should be carbohydrate, maybe rice, and the other quarter should be proteinous food. That is fish. That is fish, maybe meat, beans, or so. So take a quarter, 25%, plus the other fruits and then vegetable fruits and other refreshments that are not sugary can come into play in that aspect. So, but it is difficult for people to be able to afford living on vegetables in this country. Though we are gardening vegetables, but then we are definitely not getting them at cheaper prices. So, for that being the case, it is become a challenge for a lot of people to live with diabetes. I would say clearly that a lot of people complain of the financing aspect of diabetes. But we also say, in the absence of the best, let us see what other options we have. Like some people will tell you, can I eat chere? That's the locally prepared food. I would say it is a little bit better than rice and bread, but it doesn't mean it is the best or it is good. But in the absence of your vegetables and others, you can resort to chere. If you are not going to use sugar with it, maybe you can use it with soup and other things. Yes. So basically, the dietary modification is that you need to not use this ordinary sugar. There are sweeteners that you can use, that you can put in your tea. They are in form of tablets and in form of powder. And also, you should not be taking too much of rice, bread, and then fufu. Carbohydrate foods that are like spaghetti, potatoes, they should be the foods that you should limit. If you take rice in a day, 24 hours, like in a time of 24 hours a day, you can take rice once and then control your diet, and then take more of the vegetables, exercise, and you will be able to control your sugar level.
What can we do to prevent ourselves from having diabetics?
Okay, in preventing diabetes, I will tell you type 1 diabetes is not very preventable, as I am speaking to you right now. It is usually because it's caused, it is autoimmune, meaning the immune system fights the pancreatic cells of Langerhans, the beta cells that produce insulin and kills it. They see them as offenders or as infection due to some provocations. A lot of researchers have shown that they are usually, especially for children that have very stressful childhood, they usually develop diabetes type 1 at adult age. So that one is not preventable unless we make sure that our kids don't go through so much traumatic experiences in their lives at when they are young. So we can maybe prevent diabetes type 1 by that, reduce its occurrences. Now, coming to type 2 diabetes, it involves people being active. According to the International Diabetes Federation, it is important for every adult to be able to exercise for 3 to 5 days in a week. And then that too, each of the days you should exercise for about 30 to 45 minutes. It doesn't mean our normal daily activities, like you and I, you walk into this place to come and have a show with me, or me walk into this place to come and work. It doesn't work like that. I mean, like allocating a specific time of 30 minutes or 45 minutes each day or each other day, meaning each 2 days, to exercise, to do some mild exercise, jokes, or walk for about 30 minutes. So those are the kind of activities we're talking about. Some people go to the gym, but it doesn't mean that everybody have to go and lift. That is their own passion, and it's good. But then, if you cannot do all that, you can walk. If you cannot joke, you can walk, or you can go to the football field and play football for 30 minutes each other day. I mean, that is not going to reduce anything, and it's going to improve your health very well. So apart from being active, people should be taking cautious about the kind of foods they eat. These fatty foods and these junk foods is definitely something that is affecting us, because people have been moving from the foods that we know to the processed food. The more you enter the supermarkets and the mini markets for foods, the lesser your health will be intact. People with diabetes have different problems. But there is nothing wrong with you as a diabetes patient taking vegetables in the morning. Vegetables in the morning. Because the main meal time of the Gambia is lunch. And lunch time, 90% of the houses cook rice. So if you take bread in the morning and you take rice in the afternoon, you're definitely taking only rice, because bread and rice belong to the same family of foods, which are the carbohydrates. So since you would not be able to stop yourself from perhaps taking rice in the afternoon, best you take vegetables in the morning, and then fruits also. But then looking at it, some people definitely find it difficult to get vegetables in the morning due to some factors like finance or other issues. So some will take cherry instead of going to bread, and then some will take beans. Some will take beans actually with a little bit amount of bread. But in the more you are able to limit the amount of carbohydrate you're taking, the better for you. But there are some people also whose diabetes are very funny. They always go into hypoglycemia, which is another complication in diabetes. Like if you take the medication at night, in the morning you wake up with hunger, you start trembling, you start shivering, you know that your blood sugar level is going down. At that point in time, you can get yourself something sugary, a sweet or chocolate, or take something that has some carbohydrate to make sure your blood sugar level doesn't go below drastically. But that doesn't, it's not common. Yes. So basically, depending on vegetables in the morning, yeah, with some little amount of carbohydrate and protein will help. Yes.
Thank you, Mr. Ture. It was good having you on my show today. And what advice do you have for the people out there who are diabetics or who are even not yet diabetic patients? What advice do you give them?
Yes, we talk about all these things, and then people that are not diabetic, I will start with that. The advice I have is let us be exercising, let us be active. Being in one place and not working on our weights, getting obese, and then having being overweight and other factors like that, taking junk foods, and then always sitting. Even like my father will tell me, people are so lazy that they have to find a remote to even switch off the TV. They wouldn't have to walk a little distance to go and switch off the TV. So that was just something that I see as when he wants to joke with me. But then it is important, like it is just symbolizing that people want to do everything technology. Everybody wants to be on the phone or on the computer. Let us go to the field, to the park, and then exercise, walk together, jump around, do skip, do other things. It is important. Each day you allocate 30 minutes to that in your life, you're okay. It's very important. And the diet, the food that you eat, make sure you reduce junk foods as much as possible, the carbohydrates, these sugary biscuits, these fatty substances, we reduce them, especially those of us that have family history of being overweight or being obese. It's very important. Now, coming to those people, still on those people that do not have diabetes, at least every 6 months or so, you can go and check. Or if you've never checked your sugar level, you can go and check, even though you don't have the symptoms. Just have a baseline that this is where my sugar level is always. Then maybe one day when it is altered, you will definitely know it is altered, and you will have some concerns to find out. Then coming to the people with diabetes, let us control our diets. Let us minimize the amount of carbohydrates we are taking. Let us visit our clinical appointments every month or every 6 weeks as it is given by our doctors or our nurses. And then let us always check our sugar levels. And if we see any signs in ourselves that we don't understand, let us report back to the hospital. If you see any abnormality in yourself, go back to the hospital. And do not initiate your own management system or treatment system without consulting your doctor or your nurse. Because in this society, we have a lot of people who are self-proclaimed doctors, and they will always be misleading. They will be telling you, you should not eat this, you should not do this, and they have not learned it anywhere, and they are just putting a lot of fear and anxiety in people. So the best people to talk to are those people that have the training, they are certified to practice in the field of health, and they know about diabetes. Those are the people that you should consult when you have problems. Not the traditional herbalist, not the friend whose mother got diabetes for 10 years, not the uncle who got diabetes for 15 years. Though they have experience, patient-to-patient interaction is important, but the first point of interaction should be with the health worker who learns the disease. It's very important.
Okay, thank you, wonderful viewers. That was Mr. Usman Toure. It was good having you on my show today on this so-called health and fitness show. Until we come your way next week again, and then don't forget to subscribe to our YouTube channel on BFP. Then thank you.